it's really important for diabetic patients to know that their feet will have big impact on their life as they go along when they have long-standing diabetes. What happens is diabetes affects two parts of your blood vessels as well. Well, it affects two parts. One is your blood vessels, the other are the nerves. With time, what happens is the blood vessels start developing blockages, especially in the blood vessels below your knee. And this can cause blockages. Similarly, the sugar that's elevated in diabetes can also cause problem with your nerves. And this is the reason why, even if you have no problems, the moment you're diagnosed with diabetes, on an annual basis thereafter, once a year, you need to see a vascular surgeon so you can have your pulses as well as your feet examined to make sure that this is being tracked over the long term. This is not an atypical presentation. Many patients who've had diabetes for a long duration of time typically develop numbness in both the legs. And the numbness is in something which we call a stocking distribution, where from your toes all the way up to your knees you'll have reduced sensation, and people will complain that they can't feel anything. So much so that we have patients often who are walking on very sharp objects like nails and they don't even feel it. And this is why it's really important that all diabetic patients, as a routine, should develop a lifestyle that every night before they go to sleep, they should look at the bottom of their feet on a regular basis. Every night they should look at it or have somebody else look at it, because a cut that might be missed when it's small can become a much bigger problem later on. So this is a common presentation in patients who have diabetes and who have developed blockages in their blood vessels. As the blood vessels become narrow from the blockages, less blood is going down. When less blood is going down, then they start saying, the muscles start telling you, I need more blood. And how do they respond? They respond by cramping. This is the pain that you typically will develop if you have long-standing diabetes and you've developed something called peripheral vascular disease. In addition, part of the problem in diabetics is that because they've lost the sensation, they don't necessarily feel this pain. And this is again the reason why diabetics should be seen on a regular basis, because even if they develop blockages, because their nerves are no longer functioning, they don't present to you with pain. This is another presentation of patients who have diabetes. They have wounds which develop again from their not being able to feel on the bottom of their feet. They have poor blood supply. As a result, the wound becomes bigger and bigger without healing. And this is really the stage at which you really need to rush in to do something. Why? Because oftentimes patients who have these wounds will go on for months and eventually lose a leg. And we have seen this on patient after patient. Early diagnosis will allow you to see how to protect the foot with the appropriate footwear, to see if there is need for increase in blood supply, and by these two you can almost invariably lead to a good quality of life in a diabetic, with the long-term result of keeping their feet or their toes without loss of any other function. Who you should follow up with depends upon where you're staying. Typically, if you have access to a general practitioner or a family physician who understands the vascular changes that can happen, following up with that physician is an excellent thing to do. If not, follow up with a podiatrist, or if you want to check a more comprehensive way, you can follow up with a vascular surgeon who can check the foot as well as your circulation as well as your nerves to be able to see that you're tracked for this for a long period of time to prevent any problems. This is again something that is a bigger concept that includes things that involve blockages in your blood vessels. So patients with peripheral vascular disease would be patients typically who have very high cholesterol, are diabetic, are smokers. These are the most common group of people that will develop it. What's happening is that your blood vessels are narrowing. When they narrow, then you have problems like pain, wounds, or the fact that your pain in the feet, especially at night, is so severe that you develop eventually things like gangrene or ulcers that don't heal. All this is encompassed within the concept of peripheral vascular disease, which really is something that you need to see a vascular physician for, because most of this can be managed medically and does not actually require operations. In this day and age, almost the entire spectrum can be managed with medicines as well as through minimally invasive catheters and balloons and wires, for which you don't require any anesthesia. You just come to the hospital, get it done, you go home the same day, and that's it. The key is in early detection.